Today's best variety of R&B, 94.1 WHRP, Wednesday Hump Day, Wellness Wednesday with Dr. Whitney West. Good morning,
Morning,
doctor.
Dr. West.
Good morning.
Glad to have you with us. Tony in the morning, excited about this one because you're going to touch, people have their little fetish about, certain things in life, but one thing's for certain and one thing's for sure. Nobody wants bad breath. Right. And that said, we will be talking about the connection between oral health and women's health. Okay, so tell us, give us the connection? How's this all tie in?
So I usually tell my patients the mouth and the teeth, teeth are like the window to your soul, basically, because if you get an infection in your mouth, it's going to travel. So abscess in your tooth, and we're talking about, it gets into your system. We talk about brain issues, right? So we don't want to have a full body infection because we had a tooth that was rotten or an abscess that developed, and we don't get that taken care of. There is a link between heart disease, stroke, diabetes, from gum disease. So when you go, we always recommend you go to the dentist at least every 6 months to get a cleaning, and then more often, depending on what your issues are. Dentists actually will find a lot of issues, just like the optometrist can look in your eyes and tell you whether you've got something going on with like your blood pressure or whatever. Dentists can look in your mouth and ask you questions or guide you to the health conditions that you actually have. So it's really important that that is evaluated. Now, um, when I've seen pregnant women in the past, and I see their dentition, I ask, when is the last time you've been to the dentist? Because again, we don't want to get an infection while we're pregnant. And what a lot of them tell me is that they either haven't been in a while, they take their kids, but they don't go, which is really, really concerning because there's a risk for preterm birth, low birth weight, and then preeclampsia, which a lot of people know is toxemia or elevated blood pressure in pregnancy.
We're talking with Dr. Whitney West about the connection between oral health and women's health. Dr. West, what are some of the best practices for mouth and body health?
So, like I said, one of the things I said before is actually seeing your dentist at least twice a year, at least twice a year. But what you can do on a regular basis is brush your teeth once or twice a day. Again, I got teenagers. I got one of them in particular who fights me on this. I need her. She had braces. I need her to brush and floss every day, at
I
least
need
once a
you to
day.
work with your mom.
So, but at least once a day, and then use a really good mouthwash, right? So we got to get it through and into the teeth and that kind of stuff, and gargle and then spit it out. But those regular dental visits where your dentist can can take a look inside and get off the tartar and discuss with you if there's, you got cavities that need to be replaced or root canals that need to be done, because that sets up infection.
Well, listen, I agree with you on that. And that twice a year, at least, visit to the dentist is very helpful to your health. So, from your best girlfriend, Dr. Tony, uh, please to take time to make those dental appointments. Because one of the things that you mentioned was infections getting into your bloodstream. So your whole body's connected, ladies and gentlemen.
Mhm.
So if you have something going wrong in your mouth, it's going to eventually trickle down somewhere in your body and make probably some other health issues. And then
That's
you'll have
correct.
to go see Dr. Whitney West. From the dentist to Dr. Whitney West. I'm just saying. So brushing twice a day is probably a good, suggestion. I think dentists would be happy with that. But more importantly, what can people do? Because sometimes people don't go to the dentist because they're scared of, you know, all that stuff, really. Right. But, other than brushing twice a day, because I heard sometimes eating just like raw vegetables and stuff help to clean teeth.
Well, so I know you go to like the like a seafood restaurant, like sushi. They put wasabi and they put ginger on the plate. That cleans your palate. But outside of actually physically putting something on your teeth and stuff, there's not a whole lot of foods that are going to be able to remove what's already there. Now, it will help you in the long run because we're eating whole foods and we're doing better, in our system, which again will show up in our mouth if we're having medical conditions. But we really need to brush that teeth. We gotta brush
What's
the
those?
teeth, right? Brush and floss. If you want to use a water pick, that's just like for flossing, because some people have issues with the whole hand thing. But the water pick works just as well. But you gotta get it done. Like, you actually have to do it. Now, I will tell you, I love my dentist. I've been seeing her for over 20 years, but I don't like going. Like, I have an appointment tomorrow, right? But I gotta go, right? I
I
would
would
much rather
know.
have a different kind of an exam than go to the dentist, because that it bothers, like, that the scraping and that bothers me. But I gotta go, and I'm gonna go, and then I'm gonna hold my breath for 6 months until I gotta gotta go
Oh,
back again.
So I went last week and I got the teeth cleaned and everything. And what I appreciated was at the end being asked, "Do your teeth feel clean?" And they
Yeah,
felt so good. Yes,
yes,
I
it's
agonized through the
different.
whole visit. I'm with you, Dr. West, but I go because I know it's the right thing to do for my health. And with that, getting a little older than PT these days,
barely.
and then and then hormone changes.
Oh, absolutely. Absolutely. So, as women, we go through obviously different stages. So there's puberty, then there's, the premenopausal, and then there's menopausal. So in puberty, we have issues that we're more prone to swelling and bleeding during, while we're brushing and stuff like that, because of the hormonal changes that are happening as young teens. And then as we proceed through menopause, then we have issues with breakdown, because our calcium and vitamin D are probably low, and then we've got the hormonal changes going the opposite direction that will cause tooth loss.
Mm.
So we definitely need to make sure that we're going and being seen on a regular basis. And then in the time between puberty and menopause, we've got all the other things that happen to us, where we may be using different medications, going through different things that will cause changes in our gum health and that kind of thing.
Well, I can definitely tell the difference with my senior puberty these days. That, things have shifted, and so we just want to encourage and hopefully, somebody will take heed and go ahead and make that dental appointment and get your health together for sure. Dr. West, how can we get in contact with you?
My website is www.westmdpc.com.
And your parting words?
Empower Wellness. It is a journey, not a destination.